Welcome to 6:30 Central tonight. I'm Dawn Scott, and as we continue to work through an unprecedented time in our world, our country, and our state, we are here for you. We say it daily, we're committed to the facts of the COVID-19 pandemic and not the fear. It is our promise to you, and that means keeping you up to date on the very latest. And we want to quickly update you on what we've learned here in our state today. We now know of 22 confirmed cases of COVID-19 in Arkansas. The 6 new cases confirmed today include 2 people in Cleburne County who recently traveled out of state. The rest of the cases are in central Arkansas, and they were contracted in a healthcare setting. Also new today, Little Rock Mayor Frank Scott announced a citywide curfew. It will be in effect from midnight to 5 a.m. beginning early Wednesday. The governor and the mayor did not close any businesses in the state, but the mayor encouraged all restaurants to move to takeout and delivery only. And a reminder that starting tomorrow, all the state's public schools are under a mandatory closure. Today, the president warned the public should avoid gatherings larger than 10 people, along with discretionary travel. It's a lot of information to take in, and that is why we have Dr. Jennifer Dillaha with the Arkansas Department of Health with us tonight to answer your questions about this virus. She is an infectious disease specialist, and we appreciate you coming in. You were here with us just before all of this started. Thank you again for coming back.
I'm glad to be back.
All of what we reported, I want to just be clear, 8 counties now have seen cases of this. That's correct. And all but one of the cases was contracted out of state.
Well, the original cases were from travel, but we have secondary cases now. People who got the virus from the people who traveled and became infected.
I understand.
And we have one case that we aren't sure how they got infected. So that's probably some element of community transmission that we're starting to see.
Now, some people don't exactly know what that means. What does community transmission mean?
Well, that means that they came into contact with someone that they didn't recognize as being sick. It's not someone they may have known, but someone they interacted with and they got infected from them. So they can't really say who gave it to them.
Is it true that you actually can have the coronavirus, COVID-19, and not show any symptoms?
That is possible. It's not very common, but a little bit like influenza, when we first get the illness, our viral count, the number of viruses in our nose and mouth and this area are high. And then as we develop symptoms and begin to fight it, that count goes down. We have fewer viral particles that we can spread by sneezing and coughing. So in the beginning, before symptoms, your viral load, we call it, is higher. And those people could spread the virus, in the case of flu, a day or 2 before they have symptoms. And we think that's probably very similar in the case of this virus, the COVID-19 virus. And so in that sense, people can spread it before they have symptoms. And it's also possible, not very common, it's thought, that some people have very mild illness and may not really feel like they're sick. So they would be called what we call asymptomatic spread. That means spread without a person having symptoms that they recognize.
But you're learning this as it unfolds.
Yes, you know, this is a new virus. So we're learning a lot about it. And we are learning when the viral load is the highest, as I was speaking. We're learning about how long the virus is in the body. And there's other things we would like to learn, but we haven't yet. For example, does this virus have a seasonality to it? A little bit like flu. You know how flu kind of goes away in the summertime in warm weather? Not sure if it's the temperature or the fact that kids aren't in school. But does this virus do that? Well, we don't know yet.
There are so many questions. We will try to get to as many of your questions as we can. We don't know if we'll make it throughout this half hour, but again, we're going to try. So again, if you texted in 501-376-1111, we're going to try to get your questions in. Let's see what people are asking, Dr. Dillaha. When someone does get the virus, what type of treatment is being used? So we know there's no cure, so how are they being treated?
Well, it's supportive treatment. So they make sure that they have, if they're having trouble breathing, that their breathing is supported, they get oxygen. If it's very severe, they may need assistance with a ventilator. It's very severe cases. But over 80% of the cases do not need to go in the hospital. So they go home, they rest, they sleep, they take care of themselves, they can take care of themselves at home. There are studies being conducted now to see what treatments are truly effective and which ones are not.
If you're at home, so fluids, are there specific medicines that you can take over the
You
counter?
would treat symptomatic. So if you're having a stuffy nose, you might take something for that. If you're having a headache, you might take some acetaminophen or something like that. If you're having fever, you might take something for that.
And that brings me to another question that came in, which are what are the symptoms of coronavirus? They're so confusing, Dr. Dillaha. Many people say they're a lot like allergies, they're a lot like influenza, or even the common cold. What are there defining symptoms of the coronavirus?
Unfortunately, there's so much overlap between cold and flu and the COVID-19 symptoms. So typically we're looking for someone with moderate illness. They would have fever, cough, shortness of breath. That means people who would have what we call lower respiratory symptoms. So they would have infection in their lungs because this virus causes a pneumonia in the lower respiratory tract, in the lungs.
Is this why a number of people are saying they've gone for testing but they were turned away? Maybe they didn't travel out of state. Maybe it's not as severe as you all need it to be for testing.
Yes, so some testing of mild people who don't need to come in the hospital it would be nice if we could all be tested.
Yeah.
But because we're having to ramp up our testing capacity, we've really reserved it for people who are most likely to have the disease. So if we can reserve the testing to identify it if it's there. Now the testing is becoming more widely available. Many clinics and hospitals are using the commercial tests that are available now through many of the commercial lab companies. So we can expand the testing, and so people who aren't so severely ill have the opportunity to be tested.
Which is a little frightening, just in the sense that there could be people out there that we don't know yet who have it.
That is true. Many people can have mild illness, and this is one of the concerns. We need to expand the testing in order to identify when it's going spreading in the community, but at the same time we don't want to be wasteful of our resources because we really need to identify those highest priority patients. We know that healthcare personnel are at increased risk for being exposed to this virus in the healthcare setting. So if someone's admitted to the hospital, those people we really need to identify as quickly as possible, because if the healthcare personnel get exposed, then they have to stay home from work for 14 days for the quarantine period in case they might develop it.
Yeah.
And so if you have a large number of people exposed at a healthcare facility, you lose a lot of the workforce.
Can you get the virus if Walmart, for example, dropped off your groceries at your front door by touching things? We've gotten this question by a number of people. What about your mail? What about your groceries? Other things that you've touched, surfaces that you've been around. Dr. Dillaha, does it live on surfaces?
It can survive on surfaces for some time, hours or a day or more. I don't know that it's fully known, but the conditions in which it's more likely to survive is a hard, non-porous surface. If it's porous or cloth, the materials will absorb the moisture and the virus would be less viable.
So like this table is at more risk to carry it than a sheet of paper, for example?
Yes, and of course the temperature in the environment as well as the humidity, all those things play a role. And that's why we strongly encourage people to wipe down the commonly touched surfaces in their offices or in their homes.
Good
the
idea.
Doorknobs, the counters, those things that are non-porous, where the virus is most likely to survive.
And one of our last questions, I don't know if we're going to show a question, but a number of people are writing in, hey, we're not supposed to be in groups now of more than 10 people. What's this social distancing? Isn't this extreme? Can you speak to that? We have about 30 seconds.
Social distancing is really important. That means if you put a distance between you and other people and you're around fewer people, you're less likely to spread it if you have it, and you're less likely to get it if you don't.
So you agree with all these measures?
I do think that this is important. Social distancing is hard because that's not our habit. We shake hands, we hug people, we go together in groups, we lean over and whisper to other people. So when you have a lot of people doing that, then you're more likely to spread it, and that's why these measures are needed to kind of break those habits and make people really think about what they're doing and how they live their lives day to day.
All right, Dr. Jennifer Dillaha, an expert on infectious disease with the Arkansas Department of Health. Thank you so much. I know we'll be seeing you. I hope you'll come back to our studio in the coming days and weeks.
I'll be happy to. It's so much easier to deal with something if you know the facts.
Yes, thank you so much.